Hi, I'm Dr. Anthony Larson, and I'd like to talk for just a couple minutes about mouthwash. I get a lot of questions in my office about mouthwash. What mouthwash should I be using? Should I be using a mouthwash? So let's talk for a minute about that. There are two categories of mouthwash, cosmetic and therapeutic. Cosmetic mouthwashes are mouthwashes that don't really have any active biological ingredients. They primarily taste good, make your mouth feel good, give you fresh breath for a few minutes. And we won't really talk anymore about those. The second category of mouthwashes are therapeutic mouthwashes. These have active ingredients that are designed to control or reduce symptoms within our mouth. Some active ingredients of mouthwash include fluoride, peroxide, chlorhexidine, or essential oils. Now, therapeutic mouthwashes can be broken down primarily into three categories, or at least there are three we'll talk about today. The first being anti-cavity mouthwashes. These definitely work. Most of them contain something called sodium fluoride, and when that is topically on our teeth, the teeth do benefit from that. There is a remineralization of our enamel, and so sodium fluoride and anti-cavity mouthwashes can be helpful. So who would benefit from this? Well, I think one of the biggest beneficiaries is the teenager, especially the teenager wearing braces. An anti-cavity mouthwash can be very helpful in this case. Or any person really who is chronically getting tooth decay, especially along the gum lines or just in regular visits to the dentist. They are often diagnosed with tooth decay. In cases like this, an anti-cavity mouthwash can be beneficial. The second category of mouthwashes is anti-gingivitis mouthwashes. These do not contain sodium fluoride, but might contain chlorhexidine or other compounds that have been shown to reduce gingival inflammation or to prevent plaque or tartar buildup. So those that would benefit from anti-gingivitis medications are, of course, people who struggle with gingivitis or with chronic gum disease, periodontitis. So if you're often going to the dentist and learning that you have gum disease, if you have a buildup on your teeth often that must be scraped off in a dental visit, then an anti-gingivitis mouth rinse would be beneficial to you. The third category I want to talk about today is Xerostomia mouthwashes, or more commonly known as dry mouth mouthwashes. So people who are struggling with dry mouth, chronically dry, would benefit from finding a mouthwash specifically indicated for this condition. And they do tend to help with the symptoms of dry mouth. So, do I need a mouthwash? Possibly. If you do not suffer from any of these symptoms, you may not need one. If you're not currently using a mouthwash and you don't have problems with recurring cavities or gum disease or a severely dry mouth, then you probably don't need one. If you are using a mouthwash and say, well, I do have a mouthwash that I like, but I don't have any of those symptoms, it's probably okay. Mouthwashes, if used as directed, can be beneficial and also really don't hurt, even if you don't need them. A couple of other things to keep in mind. Children, especially those under 6, should not use a mouthwash. Mouthwashes are not designed to be swallowed or ingested, and so they're usually not indicated for young children. If you have a child using a mouth rinse, make sure they are able to completely expectorate and spit out that mouthwash. Also, there are many prescription mouthwashes available to treat some of these conditions we've talked about, and that'd be something you'd want to talk with your dental professional